Hello and welcome to our distance education project. Today we will be discussing the role of occupational therapy in the cardiac triad.
The objectives we will go through in this presentation today include participants will be able to fully describe what the cardiac triad is and the symptoms it displays. Participants will list the risk factors associated with the cardiac triad. Participants will explain the role of occupational therapy in the cardiac triad. Participants will list the interventions and treatment for cardiac triad, and participants will explain how the cardiac triad can affect activities of daily living. This slide here, we want to give you guys a minute or two to review these questions that I'll read to see what you may already know about the cardiac triad prior to our group giving information on it. So we want to know, what do you already know about the cardiac triad? Do you know anyone with any of the three conditions within the cardiac triad? What do you think causes these three conditions to affect the cardiovascular system? And how can an occupational therapist treat this condition? So we'll just go ahead and give you guys a minute or two to think of these.
So what is the cardiac triad? The cardiac triad is made up of three different health conditions: obesity, diabetes, and sleep disorder breathing. All three of these conditions can relate to major cardiovascular events. With cardiovascular diseases being the leading cause of death globally, it is important that we understand the underlying factors that can contribute to developing a cardiovascular disease. For those who are undergoing cardiac rehabilitation, these three health conditions are commonly being seen. All of these three together are interrelated and contribute to the increased morbidity and can lead to a reduction in quality of life. They could even lead to mortality. Both diabetes and sleep disorder breathing are incurable. As OTs, we can take a holistic approach and educate our clients on the proper management of each condition separately and together to help reduce cardiovascular disease and potentially cardiac events during rehabilitation.
Starting off with obesity, it's going to be important to know the difference between obesity and overweight. Overweight individuals are going to have a BMI over 25, and with obesity, the BMI is going to be over 30, but it's important to keep in mind this is also dependent on a person's height as well. So, and as of August 2021 through August 2023, per the CDC, adult obesity prevalence was 39.2% in men and 41.3% in women in the United States, and this continues to be on the rise. And women may be more prone to obesity for a number of different reasons, including a difference in hormones, increased amount of body fat compared to men, and just metabolic factors in general. And obesity itself can put an individual at risk for other conditions such as heart disease, type 2 diabetes, cancer, hypertension, and different musculoskeletal disorders. And with heart disease, this can include a plethora of disorders such as chest pain, heart attack, heart failure, because when someone's going to have that excess body fat, this is going to require the heart to work harder than an individual with a healthy body fat ratio and BMI. And obesity does not have one single cause. It can be biological, genetic, social, cultural, physical, psychological, and since it doesn't have a single cause, it's important to look at the person as a whole, and this emphasizes our need to develop a good occupational profile with our patients. So as you may know, obesity is very prevalent nationwide, and it just continues to become more of an issue as time goes on. So the role of occupational therapy in obesity is to make sure to take a preventative and restorative approach. So just in general, how does being obese affect an individual's everyday activities? It's dependent on individual to individual, but some common ones may be eating. This may be the social aspect, physical, culturally. Individuals who struggle with obesity may be at a higher risk for disordered eating, and they might have decreased self-worth around others during mealtime. And just in general, financially, fast food can often be a cheaper and easier option when it does come to mealtime, so sometimes people do opt for that as well. And this can also affect sexual activity as well. It may be a positioning issue, but it also may have a effect on diminished body image, which may lead to reluctancy to engage in those sexual behaviors. This may stem into mental health issues. And then there can also be an increase in heart rate when the heart is already working harder to pump for blood and oxygen. And then there's also community mobility, so this might be use of public transportations. They may need mobility devices to get around easier. We may need to look into different energy conservation needs. So like I said, they may need assistive equipment such as a wheelchair to get around. There may be difficulty climbing stairs. You might be reluctant to use public transportation due to their size, or potentially needing to buy an extra plane ticket or bus ticket to be able to accommodate for their size. And then also bathing is a big activity that can be affected with obesity as well. Just due to skin folds, you may not be able to adequately clean yourself because of size, and then you may need assistance with bathing due to the inability to reach all those areas, which can also diminish privacy. And this is where assistive devices may be beneficial, which we'll go ahead and touch on later in this presentation.
The second condition in the cardiac triad is diabetes. In the United States, diabetes has become very common. According to the CDC, in 2024, 38.1 million Americans above the age of 18 are living with diabetes. This makes up approximately 11.6% of American adults. Of this population, it is estimated that 90 to 95% are living with diabetes type 2, specifically. It is true that as people age, their risk of developing diabetes also increases. However, it is important to recognize that children and adolescents can also develop type 2 diabetes and are doing so at increasing rates. In order to understand type 2 diabetes, we must first understand the normal physiology of an individual without diabetes. When a person eats, glucose enters their body in the form of food. As digestion takes place, the glucose from the food will be released and will enter the bloodstream. This causes the blood sugar to rise. The pancreas makes and releases a hormone called insulin, which serves as the key to allow the glucose to enter the cells. Once in the cells, glucose can be broken down and used by the body to create energy. As this process takes place, the blood sugar will return to normal levels. For individuals with type 2 diabetes, this process looks different. Individuals with type 2 diabetes suffer from insulin resistance. What this means is that their cells are no longer responding to the insulin produced by the pancreas. Their insulin is unable to enter the cells properly in order to produce energy. When this happens, blood sugar levels will remain high and they will experience symptoms of type 2 diabetes. These symptoms include frequent urination, excessive hunger and thirst, unintended weight loss, blurry vision, neuropathy of the hands and feet, fatigue, dry skin, slowed healing of wounds, and increased infections. Most cases of type 2 diabetes can be prevented through healthy lifestyle choices. However, certain risk factors increase a person's likelihood of developing type 2 diabetes. These risk factors include being overweight. The American Society of Metabolic and Bariatric Surgery reports that 90% of individuals who are diagnosed with type 2 diabetes have a BMI above 25. Additional risk factors include having a family history, being physically inactive, and being above the age of 45. The overlap of risk factors is where we will begin to see the correlation between the three conditions associated with the cardiac triad.
The third and final component of the cardiac triad is sleep disordered breathing. Specifically, we're going to be talking about obstructive sleep apnea. This condition is characterized as upper airway dysfunction during sleep, resulting in a greater airway resistance and pharyngeal collapsibility. So the structures in your pharynx, such as the back of your tongue, your soft palate, and your epiglottis, and your uvula, are going to be blocking your airway down towards your trachea, causing you to wake up in the middle of the night due to apnea, which is defined as the cessation of airflow for a minimum of 10 seconds during breathing effort. So as you're breathing at night, the blockage in your throat affects you to not be able to get oxygen, and then you wake up, startled from not being able to breathe. So the next component is hypopnea, which is which is also occurred with obstructive sleep apnea, and it is defined as shallow and restricted breathing from airflow decreased by 30 or more percent and oxygen desaturation of 3 to 4%. So you've got a decrease of the amount of air coming in by 30%, and then that air is decreased in oxygen percentage by 3 to 4%. So you're still getting in some air, but less, with less amount of O2 than typical. So now we need to dive a little bit deeper and discuss what causes upper way dysfunction resulting in that obstructive sleep apnea. So with typical physiology, as you're sleeping, your muscles decrease in tone and your body relaxes. So naturally the tongue sinks into the back of the throat, pushing on the uvula and the soft palate, and also on the epiglottis, but it doesn't cause a blockage. Typically people don't see symptoms of apnea or hypopnea just because of our normal anatomy allows our muscles to relax without causing the blockage of our trachea and airway. So in people with sleep apnea, what we see is a significant decrease in the neuromuscular activity of the upper airway muscles. So normally your muscles relax and you're able to still breathe, but in people with sleep apnea, they relax more and they cause that blockage of air. So this also has a large component towards obesity and the weight of compression of the structures due to extra adipose tissue in your neck and also in the lining of the tissues in the back of the throat. There are a handful of risk factors associated with obstructive sleep apnea. Studies actually show that 58% of moderate to severe obstructive sleep apnea is attributable to obesity. So we also see a big risk factor as central fat distribution, as that compresses the lungs and the airway, especially while sleeping and in the supine position. Another big risk factor is just being a male and smoking as well. So that causes inflammation of the airway tissues. Alcohol use as well is a big risk factor, as that's a sedative, and it can further decrease the neuromuscular activity of the upper airway muscles. So, like, let's say you happen to do some drinking before you went to bed and you have sleep apnea, well, those muscles in your airway are going to be extra relaxed due to the alcohol. Also, being age 50 or older is a risk factor. Postmenopausal women is a risk factor due to the state of decreased estrogen and progesterone levels. That hasn't been studied too heavily, but there was a link found with it in an article listed in our resources. And lastly, just anatomical structures. So enlarged tonsils and adenoids causes crowding in your airway and can further lead to that blocking. Next up, we're going to talk about the symptoms of sleep apnea. So people experience both nightly symptoms and daily symptoms, and they present differently. So during the night, people experience disruptive snoring, and I'm sure if you know somebody who snores and you sleep next to them at night, they might not know that they snore, but you sure know that they snore. So in the research, I saw a lot that people often reported their spouse or partner snoring if they had sleep apnea. Mouth breathing is common. You know, if your nasal airway is blocked, but you can still take air in through your mouth, you're going to be a mouth breather. And then witnessing apnea as well. That means waking up at night because of the blocked airway. And restless sleep as well. If you're constantly waking up because you can't breathe, you're not going to be getting good sleep at night. Then during the day, we see symptoms like non-restorative sleep. People are waking up still tired just as much as they were when they went to bed. Fatigue and tiredness just because of that non-restorative sleep. Morning headache. This is attributable to hypoxia. When you have low oxygen coming in, it cuts off oxygen to the brain, which can lead to a headache. Excessive daytime sleepiness, also due to the restless sleep and non-restorative. This non-restorative sleep can lead to cognitive deficits in memory and attention. So, if you're really tired and you didn't get good sleep last night, how do you think you typically function the next day? Usually not too well. So if this occurs repetitively each night, it all adds up, and people aren't typically functioning to their full capacity. We also see a dry and sore throat in the morning. Can be caused by that mouth breathing at night. And then erectile dysfunction is often a symptom because as sleep apnea can lead to the reduction in testosterone levels. So we talked about snoring previously. Just a food for thought here. How many people do you know who snore? So obviously not everybody who snores has obstructive sleep apnea, but snoring is caused by the relaxation of the tongue and the muscles in the airway, and that causes a narrowing in the air path. So this results in the structures vibrating as resistive air moves through, making that snoring noise that we are all very familiar with. So this restrictive breathing phenomenon is also known as hypopnea. And if you remember from previously, that was mentioned when I was discussing the definition of obstructive sleep apnea. And we find here that it is more common in men and affects approximately 29.4 million people. But remember that 85% of the individuals with this condition have not been diagnosed. So I mentioned the snoring because if you know anybody who's a loud snorer, they might wake up at night and gasp for air. That could be the telltale sign that they have sleep apnea but are not diagnosed. All three of these conditions are strongly interrelated. Each condition affects the other, totaling to adversely affect the cardiovascular system. So let's start with obesity. Obesity attributes to the increased compression of the structures in the pharynx during obstructive sleep apnea. So you have fat deposits on the posterior lateral portion of the pharynx, the back of the throat, and that further narrows the upper airway. As a result, the combination between the decreased neuromuscular activity, as you're relaxing at night, your muscles are relaxing, the fat deposits in the back of your throat further narrow the airway passage greatly. Central fat distribution also compresses the lungs and weighs on the structures in the neck. Now we have symptoms of apnea and hypopnea, which increase the sympathetic nervous system. Your sympathetic nervous system is your fight or flight response. So during apnea and hypopnea, when your body isn't intaking the amount of oxygen it needs to survive, your body is going into fight or flight. So that triggers your blood pressure to increase and your cortisol levels to increase. Cortisol is your stress hormone. So when you have hypertension, high blood pressure, and high cortisol levels, that causes insulin resistance, leading to an inconsistent high blood sugar level, and that's known as hyperglycemia. Hyperglycemia is a key sign of diabetes. High blood sugar causes damage to the blood vessel lining, which increases your risk of atherosclerosis, which is a key factor in hypertension, coronary artery disease, myocardial infarction, and stroke.
We have told you about all these conditions individually by themselves. So now that we know a little bit of each of their background, let's go ahead and dive into how they all come together and affect the heart. So as far as obesity, if that goes untreated and without any intervention, this can continue to put intensive work onto the heart that may result in a multitude of different heart diseases. And then as far as diabetes, atherosclerosis, which is also known as the narrowing and hardening of the arteries, is going to occur when your blood sugar increases significantly, also known as hyperglycemia, which can then decrease our blood flow to the heart, which can also lead to heart diseases such as heart attack or stroke. And then regarding obstructive sleep apnea, because of the airway disturbances, physiological disturbances with sleep apnea, this can also be associated with similar heart disorders, arrhythmias of the heart, hypertension, and coronary artery disease. So as you can see, these three completely different diagnoses can all come together and do significant damage on such a vital organ such as the heart. So it's crucial that we don't take any of these symptoms of these deficits lightly.
So now that we know how these conditions affect the heart, let's talk a little bit more about how OTs can help treat patients who are experiencing the cardiac triad. As far as obesity, OTs can use a preventative approach to make lifestyle changes with individuals. This may include creating healthy habits such as making healthy meals and encouraging regular exercise, encouraging home modifications such as using adaptive equipment, looking at pressure sore management and doing so by decreasing sedentary lifestyles, and looking at the patient's motivation, and this will include using motivational interviewing. For patients with diabetes, OTs will often use a compensatory and preventative approach. Particularly with diabetes, the affected occupations are meal preparation, rest and sleep, social participation, and health management. For obstructive sleep apnea, a compensatory approach, promotion, and preventative approaches are often used. These affected occupations will include rest and sleep, health management, sexual activity, and work. Because all three of these conditions are chronic, it's important that patients are able to manage their conditions independently, while also living full and meaningful lives. Now we'll talk about some interventions that can help make this possible.
So, what kind of interventions can OTs use to treat someone with the cardiac triad? As you can see on the slide, there's a lot of different interventions that can be used. It goes all the way from assistive devices to technology to environmental modifications, nutrition education to vocational rehabilitation. There's sleep hygiene education on there, environmental modifications, CBT, which we learn a lot about. Due to there being so many different interventions and different options that we can use with our patients within the cardiac triad, today we're just going to focus on the 5 interventions that stuck out to us, even though all of them are just as important. So for the first intervention, we chose assistive devices. For obesity, different assistive devices can help support them in their daily activities, such as mobility aids and adaptive equipment for exercise, but also in the house. For diabetes, devices like glucose monitoring devices or insulin pumps can help with blood sugar management. And then for sleep disordered breathing, a CPAP machine is the most common, but there's devices out there that can help with positioning and optimizing breathing during sleep. Next is one that we're all sort of familiar with, and they are energy conservation techniques. They can be used in all 3 aspects of the cardiac triad. As OTs, we all know the 4 Ps, the plan, pace, position, and prioritize. So we can use those and apply those techniques for obesity and diabetes. Our goal with applying energy conservation techniques with obesity are to assist in managing fatigue and optimize energy levels for ADLs, promote engagement in physical exercise, and reduce sedentary behaviors. With diabetes, a person's blood sugar can fluctuate high or low, so it's important we educate our client on the importance of knowing how to conserve energy when the blood sugar is too low or too high. With sleep disordered breathing, if clients know how to conserve their energy during the day, there's a chance to reduce the daytime sleepiness and fatigue that can come from not getting enough sleep at night. So that's the biggest point with sleep disordered breathing, is just to conserve our energy during the day by using the 4 Ps, for example, or adaptive equipment. Next up is environmental modifications. With obesity, there are a lot of different ways a person can make healthier choices. Examples of this are to park further away from entrances, such as like if you're getting groceries at Walmart, to park farther away in the parking lot, to actually vacuum our house instead of letting our Roomba do it. And lastly, taking the stairs instead of an elevator if you're at work or basically anywhere else, if that option's available. As OTs, we can create a supportive home environment that encourages functional activity. With diabetes, a person's nutrition plays a big role in their health. We can focus our interventions on promoting and creating healthy eating habits. Examples of doing this, like on the slide, starting a garden in your backyard, having healthy snacks available, or joining a healthy eating cooking class. With sleep disordered breathing, creating an environment where the client can attain good sleep quality is the main goal. Examples how we can modify the environment to achieve this goal is by reducing or minimizing the noise in the room or the area and create a regular bedtime routine. Next is psychoeducation and self-management. As OTs, we address the person as a whole, so when looking into the cardiac triad and not focusing on just the diagnosis, we can help our clients with their mental health and self-management. With obesity, we can provide knowledge and skills to help them understand the underlying factors that can contribute to obesity, such as educating them on emotional eating and improving sedentary behaviors, developing healthier habits, setting goals, and lifestyle changes for weight management. With diabetes, we can help with understanding the disease process, learning about self-monitoring blood sugar, help with medication management, and explain the importance of a diabetes-specific meal. Lastly, with sleep disorder breathing, it's important that we educate clients on their condition and causes that can come from it, as well as explaining the importance of treatment adherence. Interventions for sleep disorder could be maintaining regular sleep schedule, practicing good sleep hygiene, and potentially using a CPAP to help manage systems and opening our airways whenever we sleep at night. The last one we have for today is lifestyle modification counseling. With any of the three conditions, it's important that the client realizes the lifestyle modifications that need to be made when living with any of the conditions. For obesity, we can provide individuals with the support and guidance needed to make sustainable lifestyle changes. These could be dietary modifications, increasing physical activity, or behavior change strategies. For diabetes, we can help them adopt healthy habits such as regular physical activity, a balanced meal planning schedule, and medication adherence. With sleep disordered breathing, the goal is to improve the quality of sleep and the symptoms that can come from sleep disordered breathing. We can do this by addressing potential weight loss, providing positional changes during sleep, and avoid sleep disruptive habits.
Just to wrap things up, I wanted to go ahead and review the main points to ensure we hit all the objectives that we had mentioned earlier in the presentation. So to start off, we just want to make sure to note that the OT profession is significantly underutilized when addressing these conditions, so that's why it's so important to go ahead and always continue to advocate for this profession. And the cardiac triad is made up of those three different health conditions, including diabetes, obesity, and sleep disorder breathing. And then all three of these conditions can relate to major cardiovascular events. And then some of the common symptoms that are going to overlap within all three of the health conditions are hypertension, hyperglycemia, and fatigue. And then overall, just within the cardiac triad, some of the risk factors are going to be physical inactivity, older age, obesity, and then family history. And then some of the interventions for the cardiac triad are assistive devices, energy conservation techniques, environmental modifications, psychoeducation, self-management, and lifestyle modification counseling. And I know we went through specific examples of each of these categories to an extent, but it's really important to keep in mind that any intervention and any goal for any three of these conditions has to be client-centered, and just because one intervention strategy or goal is working for client A, that doesn't mean it's automatically going to work for client B, so it's so important to keep in mind client-centered. And February is the American Heart Month, so as I said, let's continue to advocate then and every other month. It's so important not only to take care of our patients, but also think about our own health. So during the month of February, we just want everyone to take the time to think about what you can do to live a heart-healthy life. Thank you so much for joining our distance education presentation today. We hope you're able to get some more insight on what the cardiac triad is and learn some new interventions that might be able to be implemented in your future sessions with your clients. At the very end of this presentation, there's going to be a QR code that will lead to a survey that will ask you to scan about our presentation, and we would love your feedback. And then this slide here just goes through all of our sources that we use to get our information for this presentation. If you are interested in reading a little bit more up on the cardiac triad or each individual one of those three conditions.
On this slide here is the QR code mentioned. It also has a short quiz in it as well. After answering all of the questions, you will be given your results on the mini quiz. Thank you all for giving us a listen today. I hope you learned a lot about the cardiac triad.